Zimmer has suspended sales of Durom acetabular component and issued an urgent device correction letter regarding the device. The Durom cups are used in total hip replacement procedures. The Durom cups have been reported to come loose in some patients and cause the patients to undergo an additional revision surgery. The problem with the Durom cup first came to light when world-renowned orthopedic surgeon Dr. Lawrence Dorr wrote a letter to his colleagues at the American Association of Hip and Knee Surgeons, warning that he had performed revision surgery on several of his patients who showed symptoms of a loose implant, in spite of the X-rays showing no radiolucent lines or migration. During the revision surgery, the Durom cups would pop free, indicating no fixation had taken place. The Durom cup is meant to bond to the patient's bone. The outside shell of the cup is porous and has been sprayed with a highly engineered substance that allows the cup to be accepted by the human body and promotes the patient's own bone to grow into the shell. This bone ingrowth into the porous shell is what is intended to hold the cup in place. The coating on the Durom cup sold in the U.S. has a slightly different structure and is slightly thicker compared to that sold outside the U.S. Data from clinical trials outside the U.S. have demonstrated no revisions with the Durom cup in 386 cases. Here's what the company recommends for patients who have already received one of the devices. Patients implanted with the Durom cup, or who believe they may have been implanted with the Durom cup and who are experiencing pain more than 3 months after the surgery, should consult with their physician. Zimmer has instituted an aggressive plan to limit its losses in these cases by coordinating with the doctors who implanted the devices to distribute letters to the patients in the doctor's offices, encouraging the patients to negotiate directly with Zimmer's lawyers for a quick settlement of the patient's claims. Zimmer hopes to dramatically reduce its liability by dealing with the patients who are not represented by lawyers familiar with defective medical device cases. The reported offers are inadequate and seek to take advantage of the patients, according to lawyers representing patients implanted with the Durom cup. Patients should seek independent legal advice before accepting any offers of settlement.